Hi, this is Tanya from SUNY Downstate, and this is a video that we hope will provide you information about what to do if you or someone in your home gets sick. So, I first want to remind people, because we're all anxious about this virus, that 80% of the people who will get COVID-19 will have mild or moderate symptoms and are able to recover at home without medical care. All right? There's just about 15 or 20% of us that might have severe disease and need medical assistance. But if you are sick, please stay home. And when you are at home, we want you to monitor your symptoms. Again, the common COVID-19 symptoms are having a prolonged fever of over 100.4, having a dry cough, and having trouble breathing. The trouble breathing is the most serious of the symptoms. As soon as you get sick, we want you to call your doctor and make a plan. Plan for how you're going to take care of yourself. If you have a chronic ailment, how to also remember to take care of those issues, and maybe discuss with your doctor what to do if you should need more assistance. Have a plan in place. Under no circumstances should you be going out. I know this is going to be hard, but we really need people who are sick to please stay home. You should only be going out if you need urgent medical care. And absolutely, please do not take public transportation. If you need urgent medical care, you need to call 311. You need to call a first responder. Okay? So if you're sick, please do not go out. Don't go to the grocery store. Don't go to the pharmacy. Have someone else get it for you or have it delivered. And please do not use public transportation. What we are asking you to do is basically home isolation. Now, if you live in a shared apartment or a home where you have your own bedroom, what you want to do is you want to treat that as the sick room. If you have a husband, wife, children that also share that space, you need to make accommodations for them to sleep elsewhere. And if you are lucky to have more than one bathroom, you need to coordinate with your family members to have one bathroom be for you, the sick bathroom. While we're sick, we're not supposed to be hanging out with, snuggling with our pets. And absolutely, we're not supposed to be having visitors at all. When we stay home, we're not supposed to be having visitors. You want to keep that group in your home closed off from everybody else. You should not be having visitors, even if they are family members. If you live alone, again, we want you to consult with your doctor and to create a plan specifically for how to monitor your health while you are in isolation or quarantine. You need to also make a plan for how you're going to stay in touch with others because you live alone. So you need to have someone who hears from you on either a daily or maybe every 2 days so that they can keep up with your symptoms and know if you need some help. You should also figure out who's going to care for you if you should get sick. Is it going to be a friend, a neighbor, family member? You need to identify that person, make sure that they have access to your apartment if you should get really sick. And finally, we're asking people to think about identifying someone to be a healthcare proxy. A healthcare proxy is a person who can make healthcare decisions for you if you can't. And I think really what you need to do is you need to write this down and sign it. Say that so-and-so is going to be my healthcare proxy if I can't make a decision for myself, okay? When to seek medical attention. We've asked you to stay home and to monitor your symptoms. Again, most people will have only mild and moderate symptoms, and you should stay home and take care of those. But there are a couple of symptoms that really signal that you need to have medical care, urgent medical care. And that is basically if you really, really cannot breathe, if you're having extreme difficulty breathing, if you have persistent pain or pressure on your chest, if you are experiencing confusion and you just feel like you have a fuzzy brain, or someone sort of says, I try to wake you up for 10 minutes and you just would not wake up, or if there's like a bluing in your lips or around your face, which could signal that you're not getting enough oxygen, you should go to the hospital immediately. But call ahead first. In New York City, there are a number of hospitals that are designated COVID-only sites. SUNY Downstate is one of those. But as the governor is moving around resources, there might be a hospital that's closer to you that might have more resources. So you need to call your doctor and call the ER to make sure that you're going to the place that you need to go to. And regardless of your immigration status or your ability to pay, you call 311 or 844-NYC-4-NYC if you need medical assistance. You tell the dispatch or the person that you're talking to when you call 311 that you think that you have COVID-19 symptoms. And what they will do is they will make sure that the first responders wear a mask. And if you are able to also wear a mask to protect the emergency first responders. Please, please do not go to the ER unless you are severely ill. If you have a runny nose, a sore throat, you have a low-grade fever, this is most likely something else. Please stay home, because if you go to the emergency room and you didn't have COVID-19, you will definitely leave with COVID-19, okay? If you have mild or moderate symptoms, please stay home. Keep healthcare access available for those with more severe illness. We have a lot of people who are coming with mild symptoms and are waiting in line to go into the emergency room. And because their symptoms are not severe, we have to send them home. But just waiting in that line puts you at risk. And so we implore you, we beg you, please stay home and only go to the ER if you are severely ill in terms of difficulty of breathing. To prevent the spread of the virus to others, here are some things that you can do. When you are sick, you need to wash your hands often. You need to encourage the people who are around you to wash your hands often. This is again with soap and water for 20 seconds. You rub your hands between your digits, everything, your wrists. If you don't have access to soap and water, you can use hand sanitizer with at least 60% alcohol base. You need to avoid touching your eyes, nose, mouth with unwashed hands. You need to cover your cough and sneeze with a tissue, but not your hand, because then you have to wash your hand. You need to throw those tissues away. And whenever you cough and sneeze, you need to wash your hands. I know, we're washing our hands all the time. That's the way it's supposed to be. You need to clean and disinfect. Some of us are on this. We've been always very particular about cleaning, but if not, this is the time for us to step up our game. We need to clean those surfaces that we touch all the time, especially if someone is in the house. Clean with a disinfectant cleaning spray, wipe, or diluted bleach. These surfaces such as tables, doorknobs, light switches, countertops, handles, toilets, sinks, desks, keyboards, etc. And don't forget to also sanitize your phone. Our phones are disgusting. We talk on them. We carry them everywhere. They are really, really dirty. As well as remote controls for the TV or a tablet or a touchscreen. And you should also clean daily. You should clean all the bathrooms, but you should be very particular about maybe cleaning the sick room and the bathroom even more. Soft surfaces, if there's someone sick in the house, you need to maybe think about putting a cover over it after you clean that soft surface with a fabric cleaner, just to keep these surfaces clean, something that you can easily put into the wash, because we don't know how long it can stay on soft surfaces. If there's a sick person in the house, yourself or someone else, you need to avoid sharing household items. So for example, you might want to just grab a collection of, like, these are my plate, my bowl, my glass, my mug, whatever, and this is my stuff. I'm going to keep it separate. You might want to use paper plates and plastic utensils if you just don't feel like doing a lot of dishes. And we should, if there's a sick person in the house, you need to really stay on it in terms of washing all items thoroughly. Shared spaces in terms of a bathroom. You need to clean and disinfect this bathroom, especially after the sick person has used it. And if you have a common shared space like a living room, you should open the windows, weather permitting, to allow as much air to ventilate, to come through, okay? Because let's say that person has to walk through the living room to get to the kitchen. And so you want to make sure that there's air circulating in case they are coughing and spreading the virus in that space. We now think that you can also get the coronavirus by being exposed to certain body fluids. This could include blood, stool, saliva, sputum, mucus, vomit, or urine. They are now recommending that we close the lid on the toilet after we use it, because in the toilet, most people don't realize this, but little water bubbles come up, and those little water bubble, or those little mists of water, might also have the coronavirus in it. When you are cleaning up a bathroom or a bedroom of a sick person, you should be wearing a mask, not an N95 mask or a surgical mask, but just a homemade mask and gloves. And if there is soiled materials, bed linen or whatever, you should immediately take those out and wash them immediately. When doing laundry, if you have to go out or if you have a laundry in your building, you do not want to shake the laundry out. Some people do that. That might be part of their habit, but you don't want to shake it out, because if there's coronavirus on the clothes, you're putting it in the air and you could be getting it. You want to use the warmest water that you can, and to dry everything all the way. Put it in the highest temperature you can. If someone is sick in your house, you can do their laundry with yours. Maybe not if it's been soiled with body fluids, but you can just regular dirty laundry. You can wash them together, and that's okay. Wash it on the warmest temperature you can. And you want to not forget to clean and disinfect the clothes hamper, especially if you're sharing it with people. We now recommend that you wear cloth face coverings, and these are not surgical masks. These are not the N95 respirators. Those are that's essential equipment for healthcare workers and first responders. If you have a stash of it, please, especially if they're not open, please donate those to the nearest hospital immediately. They are the people who need them. If you are sick, you should wear face masks around to protect others. And if you are taking care of someone going into the sick room, you need to also wear a face mask. But you should wear a face mask whenever you go out into public. And here are some suggestions in terms of household things that you can use, like an old t-shirt, and you can make a little strap there. Personally, I like the bandana. We've all made bandana coverings for our face. I didn't put the coffee filter there. I should try that. But to use the little rubber bands, and it stays on. I need to add my coffee filters. And so when can you stop home isolation? So you can do that if the following are true. If it's been 7 days since the symptoms started and you're feeling better, like some of the symptoms have gotten, have improved, like your cough or your shortness of breath. Also, if you have, once you have not had a fever for 3 days, and when we say not had a fever, if you're taking acetaminophen or Tylenol to reduce your fever, that doesn't count. You need to wake up and not have a fever without taking medicine. And once you do that for 3 days, then you should be good to go. They are also recommending that you continue to practice social distancing for another 8 days. Because again, this is a new virus, and we're not exactly sure if people who are recovering might still have low levels of the virus, okay? This is the New York City coronavirus hotline. It's 1-888-364-3065. And here is the number for SUNY Downstate Telehealth Medicine. And you can call us and we will try to help you with any of your health questions. And we want you to stay safe and healthy. Thank you.